Phytotoxicity in sheep and goats, a scientific insight. The famous toxicologist, the Paracelsus, he has told in his quote, every substance, what we see in this world is a poison. The right dosage, it will differentiate that substance, whether it is a poison or a remedy. So likewise, all the food producing plants, the right dose differentiate it from a poison or it becomes a food. So if it is ingested in larger quantities, a food producing plant may also lead to the toxicity. And regarding phytotoxicity, rather than going into treatment, the prevention mechanism is better than treating the phytotoxicity condition. The common toxicity conditions, what we see or what we encounter in the field level, that I am going to cover in today's webinar. See, first, when we suspect for the toxicity condition, so whether it is phytotoxicity or any form of toxicity, when we suspect for toxicity, when the number of affected animals, we see the number of affected animals. Generally in toxicity condition, the number of affected animals will be more when you compare it with infectious diseases. See, for example, sheep flock. If you allow a sheep flock for grazing, if it grazed a poisonous plant, the number of affected animal will be obviously more when you compare it with an infectious disease. And we will see the clinical signs also. See, for example, if you allow a sheep to graze in a cyanogenic glycoside containing plants, and when it came back to a shed, so it might start showing salivation, it might start showing convulsions, it will start showing rapid respiration. See, based on those clinical signs, we can suspect for toxicity. And generally toxicity conditions, they don't respond to the routine treatment. See, based on the symptoms, if you start giving treatment, it won't respond. See, for example, in break and fun toxicity, we generally see the hematuria. See, if you treat for hematuria, if you give a coagulant for hematuria, see, it will respond for a brief time, but again, it will relapse. See, why it's going to relapse? Because tomorrow again, it's going to feed the break and fun plant. See, what we have to do, we have to stop grazing that animal has to stop grazing that break and fun plant. Then only the toxicity will be relieved. Then the farmer's history becomes the major part of the diagnosis of a toxicity. See, farmer's history, he is the person who is going to tell what happened to his animal. See, he will tell, so see doctor, I have left the animals for grazing. See, it has grazed in so-and-so field, and then it came back to the shed. Then it started showing the clinical sign. There the farmer's history becomes very important. See, unless he gives the history, it's very difficult to suspect that this particular thing is due to toxicity. And the fifth unique thing is about the quarrel. See, there might be quarrel between the neighboring farmers that might lead to toxicity. See, there are many veterinary cases encountered by me because of this quarrel condition. See, they go for intentional poisoning. See, suppose a farmer, he dislikes another farmer because of land issues, personal issues. See, what he is going to do, he cannot harm the human being. So his target will be on his animals, his belongings. So what is going to do? He will going to intentionally or maliciously is going to poison the animal. So how he is going to do? He will powder the abrin, use the abrin powder or use the ricin powder in phytotoxicity. And the next is what we notice. See, when we suspect for a toxicity, if you go around that particular area, the farmer, he has told, sir, I left for grazing, it came back to the shed. See, when we go around that grazing area, if we notice any poisonous plant, suppose we notice Protelaria species of plant, then we can easily suspect that this particular clinical sign is due to this Protelaria ingestion. Then prior knowledge or experience. We veterinarians, we might have encountered similar clinical sign or similar situation before, so that we can easily suspect this time that this is due to this particular toxicity. Then again, the seasonal occurrence. See, seasonal occurrence, for example, during summer. See, during summer, we know the cyanide toxicity, the propensity of cyanide toxicity will be more during the summer season because the availability of acacia leucophily young parts will be more in the summer season. So seasonal occurrence also helps in suspecting the toxicity. Then the place of occurrence. See, the place of occurrence, the plants, they have wide distribution. They grow from Kanyakumari to the Kashmir. There will be wide range of distribution of the plants. See, for example, rain-fed areas, you will see more of Mimosa invisa toxicity. If you go to a drought area, you will see acacia leucophily. You will get cyanide toxicity. So based on these points, we can suspect for the toxicity conditions. Then diagnosis of poisoning. See, for the matter, any type of toxicity, how to generally diagnose a poisoning condition. See, I told you the first classical feature is the history. See, we have to ask for the history from the farmer. See, for example, the cyanide and nitrate toxicity. So what is the history is going to tell? You will tell, I left the animals for grazing. So by the time it returned, the signs have started appearing. Or while grazing only, the animals found dead. So those will be the history given by the farmer. Or during pesticide toxicity, what is going to tell? Sir, yesterday or a week before, the pesticides has been sprayed on the crops. So accidental ingestion of those crops, the clinical signs are showing. Like that you will tell. Or anthelmintics, for example, closantel. See, closantel, what you will tell? Sir, yesterday, 2 to 3 days before, I have administered closantel. I have administered so and so dosage. Now there is apparent blindness. See, the animal is eating the objects. So likewise, the history plays a very important role in diagnosis of a poisoning. Likewise, the second one, circumstantial evidence. The circumstantial evidence are the circumstances that are posed in and around the particular toxicity area. See, for example, in pesticide toxicity, when we go around that place, so we might observe a pesticide sachet or pesticide bottle laying in the field. So that becomes a circumstantial evidence. Or to quote one classical example about the botulism, which was encountered by my colleague in Udupi district of Karnataka. So a few years back, what has happened in the Udupi district was 10 to 12 animals which were suffering from pica, they started showing abnormal symptoms. See, abnormal symptoms like they were recumbent, they are reluctant to move, and their legs were, it was like a paralysis. They suffer from a flaccid paralysis like thing. A group of veterinarians, they visited the spot, and when they go around that particular area, they noticed dumping of poultry waste and meat byproducts from the meat stall, the nearby meat stall. So what has happened there? Those meat byproducts and poultry byproducts, they served as a reservoir for the growth of this Clostridium botulinum. You know, this botulinum grows well in the anaerobic condition. So when these animals, which are already suffering from pica, they have a tendency to lick the bones. See, when they licked those byproducts, they started having this botulism condition. So because of this circumstantial evidence, unless a veterinarian go and search around that area, he could not have traced that condition to this botulism. So here circumstantial evidence played a very important role. Then the clinical sign. See, there are certain toxicity conditions wherein clinical signs play a very important role. See, for example, cyanide toxicity. Majority of the time, cyanide toxicity is a per-acute condition. So you will see found dead condition. While grazing, the animals will be found dead. Or the mimosa invisor toxicity, you will observe perineal edema. So there will be edema around the anal region is a characteristic clinical sign in case of mimosa invisor toxicity. So based on the clinical sign, you can diagnose the poisoning condition. In the postmortem findings, see, based on the postmortem finding, there are some toxicity condition which will give a pathognomonic postmortem finding like copper toxicity. See, in copper toxicity, in our area, in Asan district of Karnataka, we find higher level of copper in these days. Why we see higher level of copper is they started growing new plants. They started growing pomegranate. They started growing aracanut. They started growing grapes. So because of that, they need antifungal agent to get rid of the pest. So for that, they use copper sulfate. They use plenty of copper sulfate. See, when they sprayed copper sulfate, it percolated into the soil. Again, the plants absorbed this copper and it led to copper toxicity. When we did postmortem in those animals, we find out this gunmetal kidney. So this gunmetal kidney is a characteristic postmortem finding in case of copper toxicity. So it will serve as one of the feature in diagnosis of a poisoning. Then the laboratory evidence. See, there are many laboratory tests available to detect toxicity. See, for example, cyanide. So the gold standard test will be the picrate paper test. It acts as a spot test also to check the cyanide toxicity. Then nitrate toxicity, we get diphenylamine test to assess this nitrate toxicity. And in urea toxicity, you can estimate the level of lactate. The lactate level will be high in case of urea toxicity, and there will be ruminal alkalosis. If you check the pH of rumen, it will be in the alkaline side, and there will be metabolic acidosis in case of urea toxicity. Those are the laboratory evidences which suggest about the urea toxicity. And the final feature in diagnosis of poisoning is a unique one, it is response to treatment. See, response to treatment also acts as one of the feature in diagnosis of poisoning. See, for example, an animal is suffering from cyanide toxicity. So you have to diagnose cyanide toxicity apart from all the features. You give a specific antidote. You give sodium thiosulfate. If it responds well, then we think it is due to the cyanide toxicity. Or if the animal is suffering from OP toxicity, organophosphorus toxicity, you give the combination of atropine and 2-palm. So it is just like a magic wand. So it will recover well. The animal will recover well. The similar with this methylene blue also. in nitrate toxicity. So these are about the diagnosis of poison. Moving on to the general principle in treatment of poisoning. See whether it is due to any poisoning, what are the general principles we have to prioritize. See, before going to this, see the mode of ingestion of the phytotoxins, it will be through the oral route. See, from the oral route, it will go into the gastrointestinal tract. From the GIT, it will move into the circulation. See, once it go into the circulation, if you plot the concentration of toxicant versus the time, you will get a bell-shaped curve. What is this ascending curve? This ascending curve suggests you the absorption curve where the toxicant is going inside the circulation. Descending curve suggests you the descending elimination phase. So by altering this graph, by manipulating this graph, you can employ the general principles in treatment of poison. See how to employ or how to manipulate this graph. And there is a threshold level. This threshold level suggests you the amount of toxicants that is present in the body and above which the animal will start showing the toxicity symptoms. And what are the manipulations that we can do here? The first manipulation what we can do is the first one is you have to decrease the absorption phase. See, the toxicant is already in the GIT. So from the GIT, the toxicant has to move into the circulation. You stop that process. You stop that absorption. You try to decrease that absorption. When you decrease that absorption curve, what will happen? The resultant effect, the amount of toxin that gets built up inside the body above the threshold level will be much lesser than the actual one, right? So you have to decrease the absorption of toxin. How to decrease the absorption of toxin? One way is to induce the emesis by using hydrogen peroxide 3% saturated salt solution, a strong potassium permanganate solution. So you can use to induce the emesis, and you can induce purgation. The best purgative what we use is the osmotic purgative, magnesium sulfate. And the important one, the important thing that we use here is the activated charcoal, which acts as an adsorbent, that it will go and make a complex with the toxicant. It's going to absorb to the toxicant, and it don't allow the toxicant to get absorbed into the circulation. And what is the dosage in which the activated charcoal has to be given? So if it is in powdered form, you have to give it in the dosage of 2.5 gram per kg body weight. Suppose if it is 20 kg sheep, so it will come around 50 gram. And that 50 gram activated charcoal powder, it has to be diluted in 1 gram in 5 ml, 50 gram will be in 250 ml water. So it will become a suspension. So you drench it to the sheep. So what will happen? It will go and bind to the toxicant and leads to constipation. See, immediately after giving this activated charcoal, say for example, after 30 minutes of administering activated charcoal, you go for an osmotic purgative. After 30 minutes of administering activated charcoal, you give a magnesium sulfate so that that adsorbed complex, it will be warded off from the body. Then the lavage also you can employ. And the second manipulation, what you can do is increase the threshold level of toxicity. See what has happened here. See, by increasing the threshold level of toxicity, the resultant thing is you are decreasing the amount of toxicant that will be present in the body. See how to increase the threshold level of toxicity. There is no better thing to increase the threshold level of toxicity. How to encounter it? So we have to increase the threshold level of toxicity by giving emergency supportive treatment and also by employing emergency specific treatment. So what do you mean by emergency supportive treatment? By monitoring the vital function. So we have to immediately address the shock condition. We have to immediately address if there is any acid-base imbalance. We have to address CNS malfunction, respiratory dysfunctions, cardiac disturbances. We have to monitor the vital functions and we have to go for emergency supportive treatment. By that, you can increase the threshold level of the toxicity. Or else, if there are specific antidotes available, don't wait and don't waste the time. You immediately go for the specific antidote usage. By that, you can increase the threshold level of the toxicity. Then third one is you increase the elimination of the toxicant. You increase the descending phase. By increasing the descending phase, the same thing, the level of toxicant will be decreased in the body. How to increase the elimination of the toxicant? You use a urinary acidifier, you use a urinary alkalinizer. Suppose animal is suffering from nitrate toxicity, which is a basic toxicity. Urea toxicity, it is a basic toxicity. During that time, you use an urinary acidifier. So what is the rationale behind using a urinary acidifier? According to Anderson-Esselbalch equation, if you remember the pharmacology, acidic drug always gets absorbed in the acidic pH and a basic drug always gets absorbed in the basic pH. The same concept is used here. So whenever there is basic toxicity, use an acidifier so that the basic toxin will not get reabsorbed in the nephron. See, nephron is the main route of elimination. Nephron is the major route of elimination of the toxicant. Apart from the excretion function, it is also having reabsorption mechanism. You should not forget reabsorption mechanism. So if the toxicants are getting reabsorbed again into the body, so it's going to add up to the already built up of the toxins. See what we are going to do there. So you employ urinary acidifier for a basic toxicity. You employ urinary alkalizer for a acidic toxicity. For example, a cyanide toxicity, which is acidic form. So you use a urinary alkalinizer like sodium bicarbonate. And then you can use diuretic. After correction of fluid imbalance, you use a diuretic. And dialysis, very seldom used in our case of animals. And coming to the clinical toxicology. So in the clinical toxicology, you will come across many toxicity conditions which affects the animals: phytotoxicity, pesticides, rodenticides, urea, botulism, and zootoxins. But today's topic is the phytotoxicity. Phytotoxicity are the phytotoxins. What do you mean by phytotoxins? These are the toxins that are elaborated by the plants. And what do you mean by phytotoxicity? Phytotoxicity is a condition whereby ingestion of such plants which causes the detrimental effects on the health of animal, that condition we call it as phytotoxicity. So when the animals encounter this phytotoxicity, why they encounter phytotoxicity? Because the sheep and goat, they are indiscriminate eaters. They are not selective eaters. See, we select and we eat, but the animals, they don't select and eat. They are indiscriminate eaters. They don't know which is poisonous, which is non-poisonous, because of which they succumb from phytotoxicity. And when they succumb from phytotoxicity during drought condition, see, during drought condition, with nothing left, what they are going to do? They are going to graze everything. See, generally sheep and goat, they don't eat this lantana camera plants. See, when they have tendency to eat lantana camera plant, whenever there is scarcity of water, whenever there is drought condition, they are forced to eat on something unique plants. Or whenever there is sparse grazing areas. See, what do you mean by sparse grazing areas? See, nowadays what's happening? The urbanization it's coming up more. The urbanization, it's eating the grazing areas. So in the limited grazing areas, what the animals will do, they're going to graze whatever the limited quantity of weeds are there, the plants are there, they're going to eat that, and they succumb from phytotoxicity. And the main phytotoxicity, the common phytotoxicity condition that affect sheep and goat that I'm going to discuss today are the cyanide, nitrate toxicity, plants producing photosensitization, Crotalaria pallida toxicity, which has become more and more rampant nowadays, then Mimosa invasiva toxicity, and some miscellaneous toxicity. Why star mark behind cyanide and nitrate? Because I am going to emphasize more on this cyanide and nitrate toxicity, because these toxicities are ubiquitous in nature. See, all around India, you go to any parts of India, you come across this cyanide and nitrate toxicity. So more stress on this cyanide and nitrate toxicity. So the first one is cyanide toxicity. See, what are the sources of cyanide toxicity? If you see this plant, so what is this plant? This plant we call it as Acacia leucophyllae pod. See, in Kannada we call it as Bili Jali Marada Gida. So this Acacia leucophyllae young pods, ingestion of this Acacia leucophyllae young pods, particularly in the summer season, particularly in drought prone areas, the sheep and goats, they have the tendency to eat this. They have the tendency to get attracted towards these young pods and have the tendency to eat these young pods. So they succumb from cyanide toxicity. Then young fodder maize and young sorghum. See, young sorghum, see, below 60 centimeter, below 18 inches, see, whatever the fodder maize or a young sorghum that has been grown, it should not be given to the animals. It should not be allowed for grazing, and we should not cut and give it to the animals, because the topmost layer of this young sorghum and young maize, they contain highest level of cyanide. So you should not give, I should not allow the animals for grazing till it grows above the 2-meter height. So this is bamboo shoot. See, bamboo shoot is very delicious in nature, mainly grown in rain-fed areas. And this bamboo shoot is an attractive ingredient for elephants also. Many elephant deaths were attributed due to this bamboo shoot toxicity. See, and in our area, we make sabji out of this bamboo shoot. See, what we do, this bamboo shoot, we immerse it in water before preparing sabji. We immerse it in water. So what is the purpose of immersing this bamboo shoot in water? The cyanide, it is soluble in water. And once it is immersed in water, the cyanide gets solubilized, and we drain off that water and we use this bamboo shoot for the sabji. Whereas in animals, they cannot immerse it in water and all those things. So if they exposed to this bamboo shoot, they succumb from the cyanide toxicity. Then Eagle myrmellose fruit. See this Eagle myrmellose fruit. So the trees of this Eagle myrmellose tree, they are grown besides the road. So beside the highway, these trees are mainly grown, and the whole fruit is not toxic. So these fruits are broken. When they come and hit the road, or when they come and hit the hard object, it will be broken. So if the animals eat this Eagle myrmellose fruit, then the animals will succumb from the cyanide toxicity. And nowadays, this toxicity, this cyanide toxicity, the source of this cyanide toxicity has become more and more common. So what is this plant? This plant is Lablab leaves. In Kannada, we call it as Kadagattavre. So likewise, the regional names will be there. So Lablab leaves, it is having highest amount of cyanide before flowering stage. See, during flowering or pre-flowering stage, the cyanide content in these leaves are very much higher. So please make a note of this plant. It is causing highest exposure for cyanide toxicity. And recently, very recently, 1.5 and 2 months back, the flock of goats, they died due to ingestion of these plants. So coming to the source of cyanide toxicity, already I have shown acacia, leucophyllae, young pods, bamboo shoot, bitter almond, cassava and tapioca also. It poses cyanide toxicity. Diascorea species, Eagle myrmellose, Lablab leaves, young sorghum, they are major sources of the cyanide toxicity. And the mechanism of action, how actually the cyanide toxicity acts. See, in my topic itself, phytotoxicity in sheep and goats, a scientific perspective. Since we are seeing this toxicity under scientific umbrella, so I am discussing this mechanism of action. The cyanide, it is present in the form of cyanogenic glycoside in the plants. As you know, the plant itself contains the beta-glycosidase enzyme to cleave that cyanogenic glycoside, or if it escapes, when it comes to rumen, in the rumen, the glycosidase enzyme will be there. So in the ruminal pH, slightly towards alkaline pH, what this glycosidase enzyme will do, it will cleave the cyanogenic glycoside into hydrocyanic acid. And that HCN, or we call it as prussic acid, that is the major culprit in showing the cyanide toxicity. And this HCN gets into the circulation. See, when it gets into the circulation, what is its major mechanism of action? It is going to inhibit this electron transport chain. So what is the role of electron transport chain? It is one of the aerobic metabolic cycle involved in the generation of the energy, involved in the generation of ATP. And it is the last cycle involved in the generation of ATP. So what are the complexes involved in the electron transport chain? As the name itself suggests, it is involved in the transport of electrons from one complex to another complex. As you remember in ETC, in electron transport chain, we get 4 complexes, complex 1, 2, 3, and 4. So in between them, the transfer of electrons will take place. And the last complex, we call it as complex 4, it is made up of cytochrome oxidase. And this cytochrome oxidase, in turn, it is made up of iron, and iron, it will be in the form of ferric nature. So the ferric form of iron will be there in the cytochrome oxidase complex. And this HCN, it is having highest attraction towards the ferric form of any substance. So it will obviously go and bind to the cytochrome oxidase complex, forming cyanocytochrome oxidase complex. Once this cyanocytochrome oxidase complex is formed, cytochrome oxidase is not free. And what is the role that's supposed to be performed by the cytochrome oxidase is not going to do that. So what is the role of cytochrome oxidase? It is involved in the final utilization of the oxygen. See, what is the major purpose of oxygen in our body? For this purpose only, the oxygen is being inhaled into our body. That oxygen has to be finally utilized to generate the ATP, but that purpose is not served in cyanide toxicity. So because of this complex formation, the oxygen final utilization is inhibited and the cell will suffer from the cytotoxic anoxia. So because of cytotoxic anoxia, what will happen? There will be buildup of a condition wherein the hemoglobin is very much saturated with oxygen. See, there is no deprivation of oxygen in the body. The oxygen is very much there in the body. It will be attached with the oxygen, hemoglobin. But the thing here is the oxygen attached with the hemoglobin, it is not getting finally utilized by our body. There is hyperoxygenation of the blood, but the final utilization of the oxygen is not taking place. It is similar to a diabetic patient in our home who is having plenty of sweets on the table, but he cannot eat that. So the similar situation will be faced by the animal. So the animal will suffer from cytotoxic anoxia. So this is a pictorial description. So the complex 4, so it will be inhibited. Cyanide binds to the cytochrome oxidase, forming cyanocytochrome oxidase. There will be no final utilization of the oxygen. Then what are the clinical signs that we see in cyanide toxicity? See, they are found dead. So I already told, while grazing, the animals are found dead. The per-acute toxicity conditions will be there. And there will be restlessness. Generalized muscular tremors will be there. Why generalized muscular tremor? Because muscles are also one of the tissues which require highest amount of energy, right? Since the energy is not getting produced here, because the ATPs are not getting produced, there will be starting of muscular tremors and there will be dyspnea. Why there will be respiratory difficulty? Because the oxygen is there, but it is not getting utilized. So there will be dyspnea. There will be excess salivation. And if you observe gum, sclera, and mucous membrane, it will be bright red or cherry red in color. Why there will be bright red and cherry red? Because the oxygen is not leaving the hemoglobin here. It is very much attached to the hemoglobin. It is not being finally utilized. And because of which the blood, the venous blood will be bright red or cherry red in color. So I already told the muscle tremor and the fasciculation. And ultimately the death of the animal will be due to cytotoxic anoxia. What will be the post-mortem findings and the diagnostic features? See, there will be non-specific post-mortem finding, bloated carcass will be there. And you can see the plant parts in the rumen. You can see young acacia leucophily parts. You can see Egel murmulous fruit. You can observe any other plant parts in the post-mortem. And the blood, if you see immediately after the post-mortem, you might observe the brick red color. And diagnosis by classical gold standard test, that is Pickett paper test. It's a gold standard to specifically detect the cyanide toxicity. And what are the things that we have to collect to test this cyanide toxicity? So we have to collect ruminal contents, intestinal contents, whole blood, liver. So you freeze it and send it to the lab, or you can use a saturated solution, salt solution, or you can use 90% ethyl alcohol. So these are the things you can use to send it to the laboratory examination. Then what is the treatment for this cyanide toxicity and what is the rationale behind treating cyanide toxicity? So you already know the specific antidote for cyanide toxicity will be sodium nitrite followed by sodium thiosulfate. So why this combination? Why we use sodium nitrite? So as you know, the major rationale behind treating cyanide toxicity is we have to re-establish the utilization of oxygen. How to re-establish the utilization of oxygen? We have to free the cytochrome oxidase complex. How to free the cytochrome oxidase complex? Cyanide has to come out of that complex. How to get rid of that cyanide from that complex? You attract cyanide to another ferric ion. So how to induce that another ferric ion? We are using sodium nitrite. So what is sodium nitrite is going to do? It's going to convert a small amount of hemoglobin into methemoglobin. Methemoglobin, it will be in ferric form, whereas hemoglobin will be in the ferrous form. See, once methemoglobin is formed or once ferric form is seen, the cyanide, it gets attracted towards it and forms cyanomethemoglobin and leaving free the cytochrome oxidase complex. Now there will be re-establishment in the oxygen utilization. But here another problem is there. Our hemoglobin is getting converted into methemoglobin. Another problem starts here because methemoglobin cannot transport the oxygen. Again, we have to revert back this methemoglobin back into the hemoglobin. Then we are using sodium thiosulfate. So the purpose of using sodium thiosulfate, see sodium thiosulfate, it is pumping sulfur. It is pumping sulfur for the metabolism of the cyanide. It is converting cyanomethemoglobin into thiocyanate, and this thiocyanate is soluble in urine and it will be warded off from the body. And that's the reason why we use the combination of sodium nitrite and also sodium thiosulfate. See, the dosage of sodium nitrite will be 20 milligram per kg body weight as 1% solution, slow IV. 1% is weight by volume, 1% is 1 gram per 100 ml. So you calculate the dosage for a 20 kg and you give it to the sodium nitrite. Then sodium thiosulfate, 500 milligram per kg body weight, 25% solution, slow IV. So these both will be in the powdered form. You have to reconstitute it using distilled water. You can use the normal saline. 25% is again weight by volume. So 25 gram in the 100 ml. Then calculate the dosage accordingly. You infuse this sodium nitrate, sodium thiosulfate, slow IV. And this sodium thiosulfate, before giving it through IV infusion, slow IV infusion, orally also you are supposed to give sodium thiosulfate, 1 to 5 gram per sheep. What is the purpose of giving thiosulfate orally is, see, non-enzymatic degradation of the cyanide. I told you cyanide gets converted into thiocyanate with the help of enzyme rhodonase. See, without involvement of rhodonase, the thiosulfate, it will convert the cyanide to thiosulfate and it will be excreted out. So that is the purpose of giving it this thiosulfate orally. Apart from this, what are the other treatment that we can employ in cyanide toxicity? Go for vinegar administration. I told you a slight alkaline pH favors the conversion of cyanogenic glycoside into hydrocyanic acid. That's the reason we administer vinegar. That's the reason we give tamarind extract. That's the reason we go for grain feeding immediately after cyanide toxicity, immediately after seeing of cyanide toxicity. Then activated charcoal. Can you give activated charcoal in cyanide toxicity? Definitely not. It's not a contraindication, but it doesn't work, activated charcoal. Because activated charcoal, it works more on the non-soluble, non-polar substances, or the oil-soluble. Oil-soluble substances are unionized form of substances. This activated charcoal works more. As our hydrocyanic acid, it is polar substance. It is a water-soluble substance. Activated charcoal cannot get attracted and it doesn't absorb the cyanide much. Then you can go for cobalt supplementation. See, cobalt supplementation, it will convert cyanide into cyanocobalamin and it will be excreted in the feces. That's why we go for cobalt supplementation. Cocoa tablets is there, you can give that. Then vitamin B12, the same principle. Vitamin B12 or hydroxycobalamin you can give. Then sulfur containing amino acid. The reason being you're pumping the sulfur for the conversion of cyanide to the thiocyanate. And the recent discovery being sulfonogen. This has been started using in the human field. In the medical field, this sulfonogen is getting more popularized now. But for our veterinary formulation, it's not being used till now. It's not in the market for veterinary purpose. And another question generally what our vets ask is, can we use only sodium thiosulfate? It's very difficult to procure sodium nitrate. Can we use only sodium thiosulfate? Yes, you can use sodium thiosulfate. So sodium thiosulfate, it will also, what it will do then, if you don't use sodium nitrate, it will convert cyanocytochrome oxidase complex directly into thiocyanate, and the thiocyanate will be excreted in the feces. So this is about the cyanide toxicity. Then coming to the nitrite toxicity. In the nitrite toxicity, the major sources for nitrite toxicity being the young fodder maize or the young sorghum. See, both are the sources for cyanide and nitrite toxicity. They go hand in hand, the cyanide and the nitrite toxicity. Then the Sathyazerograzing species of grasses. If you see here, see already our vet, Dr. Chandragoda, in the past few weeks back, so he has employed methylene blue also. So that's why the blue tinge on his hand. So this is the Sathyazerograzing species. So these Sathyazerograzing species of grasses are in general nitrate toxicity. When it is generally seen is, it is having a seasonal occurrence. See what type of seasonal occurrence is, if you have a long stretch of summer, or if you have long stretch of sunny days, or if you have a long stretch of drought time and immediately interrupted by rain, or immediately interrupted by frost or mist. So at that time, in subsequent days, the nitrate buildup in the plants will be higher. That too in the weeds is going to accumulate highest amount of nitrate. So when you leave specifically the hungry animals, when you leave the hungry animal for grazing, they go and eat these weeds exponentially, and they start succumbing from the nitrate toxicity. The same thing has happened here. So it has ingested this Sathyazerograzing species of grasses, and they grazed on these grasses. And the owner, he cut these grasses and he bring it to the shed, and also he fed the same grasses. So that led to the nitrate toxicity. In this case, out of 4 cattle, 2 cattle were died, and 2 ailing animals, it was treated successfully by Dr. Chandragoda by employing this methylene blue. So one important thing here we have to observe is, see, as you know, in LSD also we are giving oral methylene blue. So as the literature says, methylene blue is having carcinogenic nature, because of which the supply of methylene blue is having constraint in the supply chain. So what he has used to treat these animals, he has taken the laboratory grade the methylene blue, and he has given this methylene blue for the treatment of nitrate toxicity, and he succeeded in treating those 2 ailing animals from nitrate toxicity. And this is amaranthus species. The ingestion of this amaranthus species and the accidental mixing of this amaranthus species with the other fodder plants, it led to death of many cattle in the Krishnamath in Udupi district of the Karnataka. So this amaranthus species led to the death of many cattle, and it is a major source of the nitrate toxicity. And major source being the young sorghum, maize plant, Sudan grass, Sathyazerograzing grasses, and all the weeds which were grown during the particular season. I told you that drought or sunny days break by the incessant rain or any mist or frost. During that time, the weeds grown will be having highest level of the nitrate. And what is the mechanism of action of this nitrate toxicity? See, nitrate toxicity, like cyanide toxicity, nitrate itself is not toxic. See, nitrate has to get converted into nitrite. So in the rumen, what will happen? So once the nitrate comes into the rumen, so in the rumen, nitrate gets converted into nitrite. Nitrite will get converted into ammonia. Ammonia will be used by the rumen rumen microbes for the synthesis of microbial protein. That's the normal process. What will happen in nitrate toxicity? The conversion of nitrate to nitrite, it will exceed the conversion of nitrite to ammonia. As a result, the buildup of nitrate happens in the rumen, and that nitrite, it will come or it will get absorbed into the circulation. Once it gets into the circulation, what this nitrite will do? This nitrite itself is an oxidizing agent. So what do you mean by oxidizing agent? Oxidizing agent is one which helps in oxidation reaction by itself undergoing reduction. See, always oxidation, it doesn't go alone, or that process does not go in one way. So always oxidation is coupled with reduction. If one is undergoing oxidation, there should be another process that is undergoing reduction. So nitrite is an oxidizing agent which is helping in oxidation of hemoglobin into methemoglobin. If you see here, there is conversion of ferrous form of hemoglobin into ferric form. There is a loss of electron, what we call oxidation. Loss of electron is oxidation, and the helping agent is here nitrite. So nitrite itself getting undergone reduction back into the nitrate. So that's how it converts hemoglobin into methemoglobin. So once hemoglobin gets converted to methemoglobin, what happens to the oxygen carrying capacity? Can hemoglobin carry oxygen? No, methemoglobin cannot carry oxygen. As a result, oxygen carrying capacity is hampered. Whereas in cyanide, hemoglobin is very much attached to the oxygen, but the final utilization of oxygen was not there. Whereas in nitrate toxicity, oxygen carrying capacity itself is hampered. And another mechanism of action of nitrite toxicity is it is causing vascular smooth muscle relaxation. Why it is causing vascular smooth muscle relaxation is this nitrite, it get converted into nitric oxide, NO. So if you remember NO, it is also called as endothelium derived relaxing factor. See, the major mechanism of action of nitric oxide is it is going to activate cyclic GMP. See, cyclic GMP, in contrast to cyclic AMP, this cyclic GMP action is inhibitory in nature. So what will be its effect on the vascular smooth muscle? So inhibitory in the sense it is going to relax the vascular smooth muscle, and as a result there will be vasodilation, and the resultant effect will be the hypotension. Then what are the clinical signs we see in the nitrate toxicity? Similar to cyanide toxicity, there will be sudden death, and there will be rapid respiration, hurried respiration, there will be respiratory rails, there will be respiratory sounds that will be coming. So that is the characteristic clinical sign of nitrate toxicity. So if you suspect for nitrate toxicity, look out for this characteristic clinical sign: rapid respiration, hurried respiration, respiratory rails. So apart from that, you see excess salivation, lacrimation, and if you observe gums, sclera, and mucous membrane, it will be chocolate brown color. So you see characteristic chocolate brown color. I will show you in this slide. And if the pregnant animals are there, it's going to abort, and there will be muscular tremor, fasciculation, and death. So immediately before death, there will be jerking of the muscles, and immediately there will be followed by the death of the animal. So this is about mechanism of action and the clinical signs. So these are some assumptions that I am going to tell you when I am discussing about the treatment employed in the nitrate toxicity. See here the mucous membrane, aquillar mucous membrane. In case of goat, this is the chocolate brown colored, and this is the normal blood, this is the chocolate brown colored blood. The postmortem or laboratory finding. Postmortem finding, if you do the postmortem, so within few minutes, if you observe the color of the blood, you can see chocolate brown colored blood, or you can appreciate the plant parts in the rumen. And there will be generalized congestion of the internal organ. Why there will be generalized congestion of the internal organ? It is due to the vasodilatory action of the nitrite. I told you it causes vasodilation, because of which we will see generalized congestion of the internal organs. And what are the things that has to be sent for laboratory? Ruminal content, intestinal content, whole blood, and the liver. And diagnosis, so there is rapid respiration clinical sign, but if you check lungs, there will be no significant lung lesion in the postmortem. And you can observe chocolate brown colored blood on the mucous membrane, and you can identify the source, and you can identify the plant parts. That's how you can diagnose, or you can employ a laboratory test. I told you diphenylamine spot test is there to detect nitrate content in the plant itself. Then the treatment. So what is the treatment that we are going to employ in the nitrate toxicity? The specific antidote, or we don't go for any other supportive treatment. We generally go for the specific antidote for nitrate toxicity, that is methylene blue. So methylene blue in the dosage of 4.4 to 8.8 milligram per kg body weight. As 1% solution, we go slow IV. 1% solution, again weight by volume. It will be available in powder form. So 1 gram in 100 ml of NS or distilled water you prepare, reconstitute it and calculate the dosage and give it slow IV. And this methylene blue itself is an oxidizing agent. Now my question is, see, nitrite is also an oxidizing agent, which is converting hemoglobin to methemoglobin. Again, you are employing another oxidizing agent to treat nitrate toxicity. What is the rationale behind here? Methylene blue. See, methylene blue, it will be in prodrug form. Once it enters the circulation, this methylene blue, it gets converted into leucomethylene blue. So the process is the reduction. That means it's an oxidizing agent. It's undergoing conversion to leucomethylene blue. Methylene blue is an oxidizing agent. It is helping in oxidation process, right? So what is that oxidation process? NADPH is getting converted into NADPH. Meanwhile, methylene blue is getting converted into leucomethylene blue. This leucomethylene blue is the reducing agent, which is actually helping our nitrate toxicity. So what this leucomethylene blue is doing? It is converting back methemoglobin back into the hemoglobin from ferric to ferrous. We call it as reduction. And that is the reason why we should not increase the dosage of this methylene blue. If you exceed the dosage of methylene blue, why we should be very careful while using methylene blue? If you exceed the dosage, by 10 to 12 milligram, so the animal will start showing signs due to the methylene hemoglobin toxicity. All the hemoglobin gets converted to methylene blue, you are going to aggravate the toxicity. Why you are going to aggravate the toxicity if you give it in higher dosage? Here, the conversion of methylene blue to leucomethylene blue, it is coupled with the conversion of NADPH to NADPH. So it is a saturation process. As long as the NADPH reserve is there, so long the methylene blue gets converted to leucomethylene blue. Once the storage of NADPH gets over, that means there will be stoppage of methylene blue to leucomethylene blue. And that's how the dosage has been calculated. So if you exceed that dosage, once the saturation process completed, no longer methylene blue gets converted to leucomethylene blue. This methylene blue itself starts converting hemoglobin to methemoglobin. So you should be very careful while employing this methylene blue. So this is methylene blue that Chandragada is giving this methylene blue for treating the animal. After giving this methylene blue, the animal is recovered back. See the color of the blood, earlier it was chocolate brown. After giving the methylene blue, the color of the blood, it changed from the chocolate brown to the red color, the normal red color. So yes, there is a change of color from the chocolate brown to the red color. So it's a sign of reverting back from the methemoglobin to the hemoglobin. Now, small snippets about the cyanide and nitrate toxicity. What we have to focus. See, whether it is cyanide or nitrate, the main thing we have to focus is never graze or never allow the animal to graze sorghum varieties less than 18 inches or 60 meter height. But the preferred one is till it reaches 2 meter height. So don't allow the animals to graze or don't cut that plant for feeding or to feed the animal. Never allow the hungry cattle to graze because it will graze more and it will succumb from toxicity. And do not allow animals to graze troublesome plants after light frost or the rain has ended a summer drought. I told you, particular season, you cannot allow those animals. And raising the cutter bar above 6 inches can reduce the nitrate content. See what will happen in cyanide toxicity. I told you the cyanide content will be more on the top most parts of the plants. Whereas in the nitrate toxicity, the nitrate amount will be more in the base of the plant. So in the stem, in the stalk, the nitrate content will be more. Whereas in cyanide, the topmost layer will be having more nitrate content. And spreading awareness about cyanogenic plant and nitrate containing plant to farmers stops the chances of these kind of deadly episodes. And another trivia. So trivia is, see, to lower cyanide toxicity, you can expect a lower level of nitrate toxicity. See, nitrate toxicity, a lower level of nitrate toxicity means a small amount of hemoglobin getting converted into methemoglobin. So some methemoglobin formation is cyanide is getting attracted to the ferric form of methemoglobin. That means you are freeing the cyanocytochrome oxidase complex. So this thing always runs in my mind. A low level of nitrate toxicity always beneficial in treating cyanide toxicity. And third one is, say, I have already stressed more on the cyanide and nitrate toxicity. So the other toxicities I am going to superficially, I am going to tell about these toxicity. Third one is plants producing photosensitization. As you know, the major photosensitizing producing plants are, the one is Hypericum, another one is Parthenium. And many tells that these sheep and goats never eat Parthenium. See, I will show you the video where it will go and go in search of Parthenium and eats the Parthenium plants only. Even though there is availability of other plants in and around, it go and eats the Parthenium plants only. Because eating Parthenium plant, it has become an habit for the sheep and goat which have the taste of this Parthenium. See, it will go and search of this Parthenium plant, go and eat this Parthenium plants. Lantana camera. So it is also a source of the photosensitization, lantana camera. So these are the clinical signs wherein we say the cutaneous eruptions and there are skin lesions on the head, and sometimes in the sheep the head will be swollen, and the condition we call it as big head condition in case of sheep and goat due to this photosensitization. Generally, we confuse this with some skin lesions, or we confuse it with some zootoxins, or we confuse it with the fungal toxin, but it's merely due to the photosensitization. See, if you observe here, only the lightly pigmented areas are affected worst. So if you see the black areas are not affected here. Only lightly pigmented area. On the white area only, the cutaneous eruptions are there, skin lesions are there. Why it is so, I am going to explain it in the mechanism of action. So this is like a native girl when you compare it with a exotic girl. So exotic girl, unpigmented area, our girls are, they are more resistant for the photosensitivity. See, photosensitization, we get two types of photosensitization. One is primary photosensitization, secondary photosensitization. The source for primary photosensitization, Parthenium and Hypericum. For secondary photosensitization, Lantana camera. So what do you mean by primary photosensitization? The name itself suggests the primary photosensitization. Here the photodynamic agent, it will be preformed in the plants. See, for example, Parthenium, the photodynamic agent Parthenin, it will be already present in the plant. If that plants are ingested by sheep and goats, it will go into the rumen. So from the rumen, the photodynamic agent enters the circulation. So from the circulation, it will enter the cutaneous circulation. See, once it enters the cutaneous circulation, once it enters particularly the non-pigmented areas, the white portion in the HF. So non-pigmented area, the UV light will fall on that photodynamic agent. Once ultraviolet rays falls on the photodynamic agent, it will energize the photodynamic agent. It will attain the high energy state. See, anything that goes up will come down, right? Any person who goes to higher position, he has to come down one day, right? Because of theory of gravity, anything that goes up will come down. The same thing happens here. This photodynamic agent, it attains the high energy state, it goes above, and it will come back into the low energy state. So meanwhile, that energy will be released, and that energy, that released energy, is going to start producing the free radicals in the cutaneous part. So that free radicals, you know what it's going to do? It's going to damage the cellular membrane. It's going to damage the cell membrane of the cutaneous cells. It's going to produce the cutaneous lesions. That is the reason why photosensitization causes cutaneous lesions. Whereas in case of secondary photosensitization, the source being lantana camera, we don't find the photodynamic agent preformed in lantana camera. So how it's going to produce photosensitization then? In lantana camera, like any other plant, the chlorophyll will be there, the chlorophyll pigment will be there. Once it goes into the liver, that chlorophyll gets converted into phytoerythrin. This phytoerythrin is the photodynamic agent. See, normally what happens to phytoerythrin? It will be excreted out through biliary route. It's a normal way of getting excreted out. Whereas whenever there is liver damage or anything that has caused liver damage or anything that has obstructed the bile duct, it will start accumulating the photodynamic, the phytoerythrin. The phytoerythrin starts building up in the circulation. And this phytoerythrin itself acts as the photodynamic agent. And the cycles, the same cycle. That photodynamic agent will go into the cutaneous circulation. It's going to cause the skin lesion. Then what are the clinical signs? So any type of photosensitization, whether it is primary or secondary, there will be photophobia, scratch affected parts, there will be erythema, scab necrosis, there is sloughing of epidermal structure, and there will be signs related to hepatic damage, particularly in case of secondary photosensitization. You might have observed animals eating lantana camera, they will be having this edema, submandibular edema will be there, brisket edema will be there, jaundice-like lesions will be there, frequent anorexia will be there. So those signs are related to the hepatic damage. The postmortem finding, liver necrosis, hepatomegaly, diagnosis, normal way of diagnosis, treating. So the treating here is immediate removal of this cause. So unless you stop the animal from eating Parthenium or stop eating lantana camera, this photosensitization never reverts back. If it starts eating again Parthenium, again lantana camera, that condition cannot be reverted back. If you make the animal stop eating Parthenium and lantana camera, within 2 months, the conditions will be reverted back. So apart from that, you can go for any other supportive treatment for the photosensitization. The next important topic is the Crotalaria pallida. See why it is important, because nowadays many deaths of sheep and goats are being attributed to this toxicity, this plant toxicity. See, Crotalaria pallida. Some parts we call it as Crotalaria pallida, Crotalaria retusa. So these plants, so the characteristic feature of these plants are you get yellow flowers, and these are weeds. So these weeds have become so much ubiquitous, it has started invading our normal areas also. It has started invading many of our areas. It has started invading Parthenium locations also. So much ubiquitous these plants will be. This will start growing from October to April. So from October till April to May, these weeds are more grown and more animals will succumb from this Crotalaria toxicity. And if you observe here, you see pods also. You see light pods also, green pods, and this is the stage where the animals suffer a lot. During flowering stage, during pods, during the young pods, eating of young pods will lead to the Crotalaria toxicity. So this is old plant. So where the pods have turned from green to the black. So eating of these black plants will not lead to toxicity. Eating of the green pods, eating of the leaves will lead to the toxicity condition. So many newspapers reported the death of this Crotalaria in Davangere district of Karnataka. Many sheep and goats died due to Crotalaria toxicity. So when you perform postmortem, there are yellow tinge that are present in the subcutaneous tissue, jaundice-like symptoms. And in Kolar district of Karnataka, many deaths of sheep and goats were reported due to this Crotalaria toxicity. Many number, around 120 to 140 sheep were died alone due to this Crotalaria toxicity in and around the Kolar district in Karnataka. So this Crotalaria pallida or Crotalaria retusa or Crotalaria spectabilis, so called by different names in different parts. So they mainly contain pyrrolizidine alkaloids. So this pyrrolizidine alkaloid particularly present in Crotalaria, we call it as monocrotaline. And this monocrotaline, once gets ingested inside, it gets converted into pyrrole. And this pyrrole, it will start generates the formation of free radicals. And that free radicals is going to cause the liver damage. And that's the reason why the clinical signs what we see mainly due to the hepatotoxicity. And what are the clinical signs we see in Crotalaria toxicity? There will be severe ruminal impaction, bloat, death, and if they survive, they will show anorexia, jaundice, staggering gait, and the death of the animal. And what are the treatment generally employed in Crotalaria toxicity? Generally, if the animal suffer from peracute condition, very difficult to treat such animals. Or else, if they are ailing, you can go for chloramphenicol. Why we go for chloramphenicol and antibiotic to treat Crotalaria toxicity? Because microsome enzyme is involved in the conversion of monocrotaline to pyrrole. So that rationale is being employed here. Chloramphenicol being microsomal enzyme inhibitor, it inhibits the conversion of monocrotaline to pyrrole. Or for that matter, you can also use metronidazole. You use metronidazole, chloramphenicol, so that the conversion of monocrotaline to pyrrole will be stopped. You can use liver tonic, vitamin supplement. You can use sulfur-containing amino acid. Why we have to push sulfur-containing amino acid? Because glutathione S transferase, the activity of glutathione S transferase will be more, so that it will scavenge all the free radicals. So these are the supportive treatment you can employ in case of the Crotalaria toxicity. So it is becoming more and more rampant nowadays. So give some importance about this Crotalaria toxicity. Then Mimosa inversa, which is being seen more often nowadays. So the major clinical sign what we see in Mimosa inversa toxicity is the perennial edema, the edema around the anal region. There is a characteristic clinical sign in Mimosa inversa toxicity. So this is the Mimosa inversa, very much similar to the Mimosa pudica, touch-me-not plant. But the differential feature here is this leaves, it won't contract. It won't contract. If you touch it, it won't squeeze. It won't contract. So these are Mimosa inversa plant. It is reported in Alur district of our Karnataka. You see Mimosa inversa plant. So it will be like this. So there will be rampant growth of this plant along with the Mimosa pudica. So difficult to differentiate between Mimosa pudica and inversa. So by touching the leaves, you can differentiate it. We don't squeeze back like that of Mimosa pudica. It is not going to squeeze back. So Mimosa inversa, the major toxin that is present in the Mimosa inversa. For a toxicologist, it is toxin, phytotoxin. For a nutritionist, it is an anti-nutritional factor, mimosin. See, mimosin is the culprit here that is going to cause nephrotoxicity. So some says this nephrotoxicity is irreversible in nature. Once nephrotoxicity sets in, difficult to revert back from that animals. Once the perennial edema starts showing, those animals are very difficult to treat, are very difficult that animal, the successful treatment has been happened. So what are the clinical signs? I told you perennial edema, then brisket edema will also be there, and pelleted dung. In case of cattle, the dung will be in the pellet form, like a sheep and goat. The manure from the sheep and goat, the pelleted like dung will be released from the cattle. Urine output will be decreased, and they recommend the treatment, the supported treatment, what they're employed, and they become successful are usage of corticosteroid, NSAID to counteract the nephritis, then go for fluid therapy, and the preferred diuretic is they go for osmotic diuretic. So you can go for an osmotic diuretic like mannitol, you can go. And awareness. So rather than treating this mimosa invaser toxicity, more and more awareness has to be created about this mimosa invaser plant to the farmers. Then some miscellaneous toxicity plants. So one is subabul. It also leads to more number of toxicity. Then ferns, lectin containing plant, euphorbia. It doesn't cause mortality, but it causes major clinical sign. And ficus gayala and onion toxicity. Subabul, as you know, subabul is one of the richest source of protein. So it is more often fed to the animals. See what will happen when the subabul toxicity are seen? When the subabul are fed in higher amounts over a longer period of time. So in this sheep, subabul administration was for over a period of 3 to 4 months continuously. So it is being the major fodder that is administered to the or given to the sheep, and wherein there is alopecia. If you see, there is alopecia, loss of appetite, excessive salivation, incoordination of gait, and there is decrease in the weight gain. So these are some of the symptoms you see in the subabul toxicities. So supportive treatment, rather than going for treatment, you stop giving the subabul. Within 2 months, the condition will be reverted back. That's the simple manipulation you can do in the subabul toxicity. And these are the plants which contain lectins or tox albumin. One is abrin or Abrus precatorius. In Kannada we call it as gulaganji, and another one is castor seed. See, these both are highly toxic compound. The whole abrin seed is not toxic. If you crush it and give it to the animals, or if they ingest the crushed seed, it's going to die. The whole seed is not going to cause any toxicity. Similarly, here also the leaves are toxic. The Ricinus communis, the leaves are toxic. The crushed seeds are toxic, and majority of time I have seen improperly treated castor seed cake also poses this ricin toxicity. So what are the clinical signs? Non-specific clinical signs are seen in this type of plants, and supportive treatment are employed for these plants. And this is fern, bracken fern, Christiella parasitica we call it as, or Pteridium aquilinum. So what is the mechanism of action? The major phytotoxin what we see is thiaminase in case of non-ruminants, and for ruminants it is tacrolimuside. Tacrolimuside is the culprit. So what it's going to do? It inhibits the precursor cell in the bone marrow. It mainly impacts the cells, the precursor cell which is having lesser lifespan, like that of thrombocyte. It mainly affects the platelets. It causes thrombocytopenia. You know, platelets are having important role in clotting mechanism. There will be thrombocytopenia, and the bleeding tendency is mainly due to this thrombocytopenia. That's why the major clinical sign, epistaxis melina and hematuria, the syndrome we call it as bovine enzootic hematuria, it is attributed to this thrombocytopenia. The symptomatic treatment, so I already told that rather than going for symptomatic treatment, stop from the animals grazing this bracken fern plant, the condition will be reverted back. And this is euphorbia. This plant, so you might have seen these plants which are rampant in grazing fields. You see these plants in grazing field. So if you remove the leaves of this plant, a latex will be, you see the latex coming out. So this is euphorbia plant. If you remove the leaves, the latex will be coming out, right? So these plants generally they cause severe diarrhea in case of sheep and goats. The sheep and goats, they suffer from severe diarrhea in case of ingestion of these plants. And this is ficus gayala. Ficus gayala, in Kannada we call it as karibasri. These are more frequently encountered in rain-fed areas. So ingestion of these plants, what will happen? The farmer, they use the logs of this tree, and they give leaves for the feeding of the Malnad cattle and our sheep and goats. What will happen here? So this ficus gayala is a neurodisruptive toxin. So it's going to cause excitement. It's going to cause generalized seizures. It's going to cause generalized madness-like syndrome. So like a rabies, the symptoms will be there. So there will be mad running will be there, pushing into the inanimate object, and paddling of the limbs will be there. And then there will be generalized convulsions, and the death of the animal will also seen in the ficus gayala toxicity. Again, you go for anticonvulsant and stop the animals from feeding this ficus gayala plant. And onion. See, onion in northern parts of Karnataka, many more toxicities due to onion. we come across. See, onion, the colored onions. See, while grading this onion, the colored onions, it will be left out in the field, and the cattle and sheep and goats eating this onion, generally they suffer from esophageal obstruction. Unfortunately, if that onion passes the esophagus and goes into the gastrointestinal tract, it succumbs from the onion toxicity. The major culprit being N-propyl disulfide, which is going to cause hemoglobinuria. There will be severe hemoglobinuria due to this onion toxicity. As a result, there will be pale mucous membrane. If you see the mucous membrane, there will be pale mucous membrane. Generally, they go for blood transfusion. They use plasma volume expanders, hematonics, iron dextrose injection, and the dextrose infusion in case of iron toxicity. So there are certain take-home points, spreading awareness about the possible phytotoxicity among the farmers. Rather than employing treatment regimen, you spread the awareness about the possible phytotoxicity condition, and not advisable to leave hungry animals for grazing. So you feed them before you leaving it for grazing, and not advisable to leave animal for grazing when a long drought is interrupted suddenly with rain. So this will be encountered with cyanide and nitrate toxicity. So we have to restrict this. And zero grazing will be an option to cut down phytotoxicity during grazing. Since the grazing is the one which is causing this phytotoxicity, you can switch on from grazing to zero grazing. You tie it in our shed, you give the fodder what you like. What are the selected fodders you need, or what are the selected fodders you give to the animal, they are going to eat. So it will become a selective feeders. Then specific antidotes are anti-toxicity. See, sometimes we will not be having the specific antidotes. The animal is suffering from opiate toxicity, but will not be having 2-POM in the field level. So better to have the storage of this 2-POM, sodium thiosulfate, and methylene blue. It will come handy in nature. So there are some toxicities that we encounter. Suddenly we can go for these toxicities, and I can protect the animal from toxicity episodes. So thanks for patience listening.